Okay, so welcome to our skin presentation. This will probably be in more than one part so that we can get it all in here. But what we're going to talk about is the integumentary system. You guys have covered integument, I'm sure, in A and P. That's when we're talking about the skin and all the covering of the body. So when we look at specifically the integumentary system and things that can cause problems within it, okay, that would be mutagens that we're concerned about. Sunlight, we all have heard about the importance of using sunscreen and everything like that whenever you're looking at your integumentary system to prevent skin cancer. It can also cause burns and other complications within our integumentary system. Insects and other arthropods, this can be anything from mosquitoes to ticks, spiders, things like that. Infectious organisms, especially in our pediatric population. These are organisms that are going to cause skin rashes or loss of skin integrity, ulcerations, things like that. Chemicals, you can receive burns, or chemicals can be absorbed through your skin to cause complications. And then physical agents, so wounds, things like that that can cause damage to our integumentary system. Rashes and lesions tend to be the first thing that people think about when we think about complications that go on with our skin and our body system related to integumentary. Rashes are whenever there's temporary eruptions of the skin. Okay, so we've all probably have had a rash at some point. They're temporary, they come and go. Most often they bump up. They'll often be red in color. They're often associated with skin disease or childhood diseases such as chickenpox or rubella, measles, mumps, those types of things. Heat, diaper rash is another common problem among children as well, or even drug-induced reactions. If people have an allergic reaction to medications, they will often get a skin rash too. A lesion is going to be a problem with the integrity of the skin where there's been trauma or some type of pathological problem that has caused the tissue itself to not be continuous anymore or not be able to function, meaning that it's open, it's caused a sore or a blister of some kind, and that area of skin now cannot perform its duty. There's different types of rashes, and we often describe them because of how they look. So blanched would be a white rash, anything that causes the skin to lose pigmentation and to be white in color. Erythematous means that it's red. You can see the pictures here to help you to think about these. Hemorrhagic or purpuric we've talked about before. That came up whenever we talked about meningitis, for example. That's wherever the rash itself, the different eruptions contain blood within them, and they look purple in color, and they don't go away if you push on them. Remember the jar example or the glass that you can see through? Pigmented is whenever the rash itself has a darker pigmented color or a darker color tone than the rest of the skin. And then we also say they're either generalized, meaning they're in a large area over different surfaces of the body, or they're local, they're contained to one part. Like for instance, you might have a rash on your arm if you got into poison ivy. Here's an example of erythema. See, the rash is red. It doesn't necessarily describe the specific rash or the location. We're just saying it's red. This would be an example of the bullseye rash that someone would get if they had Lyme disease after a tick bite. Notice the dark circle in the center followed by the outer ring. Here's one of a hemorrhagic or purpura rash. You can clearly see that that rash contains blood underneath of it in the wound area. Pigmented, you can see how there's different darknesses or tones of the same skin color. Right, so you have some darker tans and lighter colors of the skin. There's different types of skin lesions. So remember, lesions are more of a pathological change in the skin surface. A blister is whenever you have a vesicle or a fluid-filled papule. All right, we've all gotten blisters probably before, either from your shoes or from working on your hands, raking leaves or something. And just think about that. It's that thin little bubble that appears under the surface of the skin. They can rupture and break, or they can maintain that bubble on top until they heal. A callus is whenever you have a plaque formation of the skin because of chronic pressure or friction. So for instance, this example is on the foot. You may also see them on like people's hands depending on their job or their career type. Like a musician would have them on the tips of their fingers if they play string instruments, things like that. Corns are small, well bordered or circumscribed, conical keratinous thickenings of the skin. All right, so they're small, hard little bumps essentially. A lot of people tend to get them on their feet in particular. All right, so here's some common disorders of the skin and what they look like. So alopecia, that's the top picture of the guy with his hair, is where they have loss of hair in patches. Infantile acropustulosis is tiny little bumps on the skin. Usually we see them on their hands and in other areas of the skin on newborns, where they get little bumps that can have pustules or fluid under them. Keloids is where, that's the picture of the bumps under the ear there. Keloids tend to be where there have been trauma or irritation, maybe a wound or an incision, and then when the wound tries to heal or the lesion tries to heal, what happens is the skin overproduces and creates large masses of scar tissue. It's particularly common if wounds have been infected, and then in certain races as well. So, for instance, African Americans are much more prone to keloid formation than Caucasians. Mongolian spots, you can see the little baby bottom there, are areas of darkened pigmentation. They're completely benign. What happens is it's a normal feature that happens, it's like a birthmark, especially in darker skin races such as Asians or African Americans. But you can see how it almost looks bruised. So it's important to know Mongolian spots and what they look like so that we don't mistake them for signs of abuse. It's important to know because we don't want to report anything, for instance, if it's a completely benign feature. But they're often found across the top of the buttocks and in the sacral areas. You can also find them at the base of the neck a lot of times. They can be anywhere else on the body, but those are the most common areas. Atopic dermatitis is what we describe as most normal skin rashes, where someone has come in contact with an irritant, perhaps they changed like laundry detergent or body wash, and then it has caused a very generalized bumpy rash on the skin. It's often very itchy. Rosacea are little red, flat, often dry-looking patches on the skin. You can see there's two there on this person's side. Psoriasis, you've often probably have known someone or seen commercials for psoriasis. It causes flaking, big red patches on the skin. Oftentimes it will be across their core, behind their ears, and on their arms are common places for rosacea or for psoriasis. It's an autoimmune problem, so people can take some medication to help control psoriasis. And then lichen planus is what we would call ringworm. Right, so oftentimes this is a fungal infection of the skin, and you might have had problems with this if you're an athlete. A lot of times this can happen in moist, dark areas of the skin folds and on the surface of the skin. It can also be spread easily in areas like locker rooms, showers, bathrooms, things like that. If you've lived in the dorms, you might have even ended up with ringworm. Ultraviolet rays are why we're concerned about sunlight exposure. So what happens in sunlight exposure is that these ultraviolet rays can directly damage our skin cells, and they're going to accelerate the effect of aging on our skin. So we know when we talked about cancer that often you are predetermined based on your genes and your family history about cancer. All right, but what happens is that you can do things to accelerate the aging, because we know, for instance, cancer, as we get older, we're much more likely to get some form of cancer. If we expose our skin to ultraviolet rays in our integumentary system, you're going to accelerate them towards that threshold of mutating into cancer cells, essentially. Right, and that would further predispose them to changing over to cancerous type cells. All right, so for people who have a history or are concerned about exposure to skin or to sun, they should avoid sun exposure. You can do that by wearing hats, staying in the shade, wearing light layers such as protective clothing. I know it may seem silly to wear long sleeves and pants in the summertime, but if you're going to be exposed to the sun, especially if you have a history of skin cancer, you should use clothing to help protect you and to keep that UV light from getting on the skin directly. And then the use of sunscreen. I encourage everybody all the time to actually read your sunscreen bottles. It's often enlightening whenever you look at them about how often you're supposed to put them on, when you're supposed to put them on. So for instance, you're going to the beach this summer, you don't put your sunscreen on when you walk out into the sand. You're supposed to put it on about a half hour to an hour before you're even exposed to the sun. And then you're supposed to reapply most of them about every 2 hours. And I think about it like whenever I go to the beach, I usually am that person who walks out onto the beach, I put my sunblock on, I spray my kids down and wipe them down with sunblock, and then I don't remember to do it again until like lunchtime, hours later. But you want to think about that. The best protection from the sun is if you reapply it. Make sure that you apply it liberally to all the areas that are going to have sun exposure. Don't forget certain areas like the tops of your ears. Guys, if you have short hair, you want to put it in your hair, your forehead, things like that. The most common areas for skin cancer, especially in men, is the tops of the head or the ears is where we find it the first. Because they often get sunburns of the scalp and not realize it or not think to put sunblock there as well. Right. We can also have photosensitivity that can happen with medications or drugs. So that's whenever you're overly sensitive to light, right? So you have an exaggerated response to ultraviolet light because of a drug that you're taking. All right, so for example, certain antibiotics, such as tetracyclines, can cause photosensitivity. It would make you easier to get sunburnt, for example, or to have rashes that happen because of sunlight exposure. Antihistamines. How many of us take allergy meds, especially this time of year? Those can also make you overly sensitive to light. Antipsychotic agents, diuretic, hypoglycemic agents, which diabetic patients take, and non-steroidal anti-inflammatory drugs. So our NSAIDs, we've talked about these in the past with other related illnesses and inflammation, but these are things like your Motrin and ibuprofen. All right. Things to think about whenever we're looking at protection from sun. All right, so chess can help you remember this. We should use clothing that is sun protective, hats with wide brims that are all around. So not just a baseball cap that covers your face, but also a wide brim so your ears get protection, your neck as well. Use glasses that block out UVA and UVB. So actually check your sunglasses and see how much UV light exposure they give you help with. Use a sunblock that's more than 15% and use it as it's directed and apply as often as it's directed. And then go in the shade, especially during the areas of the highest exposure to the sun. So when the sun's the highest and the brightest, and that would be between 10 a.m. and 4 p.m. All right, so I'm going to stop there with this part. You can pick up by watching the video for part 2 for the integumentary system.